Hello, everyone, and warmly welcome. I would say good morning, good afternoon, and for those joining us from the Pacific, good night. Today, we will have a webinar under the optimistic and perhaps provoking title, The Gradual Introduction of Universal Social Security is Feasible and Already Happening. The background is that while universal social protection is today broadly embraced as a goal or at least a vision, most social security programs in low and middle income countries are poverty targeted rather than universal, especially if they're supported by international development partners. The standard argument is that universal social security is simply not affordable in poor countries. And that typically overrides all arguments for universality. It's just not possible. It's widely assumed. And that is usually the end of the discussion. But today, that is the beginning of the discussion. And we will challenge that universality is too expensive. And we will do so through the presentation of two new reports. The first one, an affordable and feasible pathway to universal social security using the principle of universality, was actually published last year, but we haven't presented it like this before. It is an analysis of what a gradual introduction of a hypothetical reform program would cost and what impact it would have on consumption and poverty. The second one is a purely empirical and descriptive study, and it is what the title says, a compilation of universal or benefit-tested social security programs in low and middle income countries that already exist. Now, before jumping into the introduction of speakers and program, I'd like to say a few practical things. As you can see here, the session is being recorded, so you can see it afterwards. There's also an AI-generated captions or subtext, which could be helpful, perhaps, so you can activate them through the CC button. As participants in this Zoom webinar, you cannot speak or raise your hand, but you're more than welcome to use the chat for comments and sharing of useful links. And it's nice if you present yourself with name, affiliation, and country. I also hope that you will put questions in the Q&A box, and please indicate if they are directed at any specific speaker. So this is the agenda and the persons who will make prepared contributions. I should say that one of the speakers, Dr. Luc Boussal, his participation is dependent on a flight being on time, and we still don't know whether it was on time. So we still hope for him to join, but I can't promise. But as you can see, we aim at having 25 minutes for Q&A, and I'll do my very best to make all speakers stick to the time limit. Be plenty of time for questions. But before I give the floor to the first speaker, I would like you to respond to a poll to get a feeling of the ideas and beliefs of you who participate in this meeting. And the question is, do you think it's financially feasible to introduce universal old age, child and disability benefits in low and middle income countries in a stepwise manner? And I give you a few seconds to think and respond. Now, it seems like we have a quite convinced audience here. Well, that's encouraging, and hope that at least the figures haven't been changed to the less, but rather improved on the yes side. We have some more background on the speakers, but in the interest of time, you will be able to read the details later, and I'll just make a brief presentation before each of you speak. And as Stephen would be the first to present, I'll say something about you now. Stephen Kidd, you're a senior social protection specialist at Development Pathways. And more than so, you are the founder of Development Pathways. Before that, you were policy director at HelpAge. Before that, leading the social protection team at DFID in the UK. Social anthropologist by training, and has worked across more than 40 countries in all over the world. And please explain to us how universal security can be affordable in low and middle income countries. You have, say, 15 minutes or 14 minutes from now. Please.
Thanks very much, Gunnar. So we don't have much time, but it's sorry, yeah, we got the right presentation view up. So I'll get straight into it. So there's a paper that was published a few months ago, just doing some theoretical analysis to see how you could build universal social security systems over time using the principle of universality. But, I'd like to start, I think generally everybody sort of buys into the idea of universal social protection as an aspiration, although how we get there, there's a lot of differences in opinion, but it is, a basic right for everybody to be able to access social security. So it should be an aspiration for everybody in all institutions to move towards that. The danger is that you can sometimes try to move towards it through poverty targeting, yet that is unlikely to be successful. So perhaps the best way is to do it by starting with universal schemes. And this is what the paper looks at a bit more detail. So the key question that we want to ask is, can a universal social security system be built by targeting initially the poorest members of society, or is it much better to start with universal benefits and grow the system over time? And is this financially feasible? Now, challenge when we start a system with poverty benefits is that they're just not very popular. So let's just look at a population here from the poorest to the richest. This is very idealistic, ideal sort of representation. And let's look at the amount of taxation that people will pay. So even in a regressive system, the richer people tend to pay more in absolute terms in tax than people who are poorer, even if we have a lot of VAT. Still, because they're buying more, the richest are paying more tax. And we've got, of course, the income tax and other taxes on top of that. So you can see the amount of tax here, ideally, that people might be paying. But if you look at the amount of benefit received, you look at the type of benefit that people receive. If you just give a benefit down here in the orange to the very poorest, then it's not going to be popular, because most taxpayers will not be happy. They're going to say, why am I paying my tax if I'm not receiving my benefits? And it's rare then for poverty targeted schemes, very rare to expand out into universal schemes. They tend to stay the same, or they tend to reduce and disappear. So Brazil's Bolsa Familia scheme, which was very well known, best targeted scheme in the world, only had 44% errors in it. It was meant to always grow into a universal benefit, but expansion stalled and it never remained there. Generally because, these schemes are just not popular. People don't trust government when poverty benefits are put in place. Mexico's Prospero Oportunidades program is another really well-known example, but in, again, exclusion error is 54%. Not particularly well delivered, but given a lot of international exposure. But then when a progressive president came in place in around 2019, he canceled the whole program. It completely disappeared, leaving young children in Mexico without any cash benefits, but put in place a series of universal benefits instead for old age pensions and persons with disabilities. So the poverty benefits are not going to work. And with universal benefits, they're going to be much more popular. So if we go back to what we looked at before, our poverty benefit here, if we put in place a benefit that goes to everybody, then everybody who pays tax is going to benefit from it. So everybody's going to be more likely to be happy, more willing to pay their taxes. That's why we can see that tax revenues can expand over time. And, and even we'll find that universal benefits generally tend to pay higher value benefits than poverty benefits. And so you'd probably find that people are benefiting more, such as we have here, and be even more popular. So these are much more likely to expand. Universal benefits are much more likely to expand because of their overall popularity. If you don't believe me that universal benefits pay higher benefits than poverty benefits, we did a study of old age pensions in low and middle income countries, looked at the coverage of the pension system amongst over 65s, and the transfer value on the y-axis up the left. And you can see in the orange trend line that generally, yes, universal benefits tend to have higher value transfers. And when you look at high income countries as well, those with high coverage have average transfers of 17.6% of GDP and per capita, and those coverage below 40%, the average value is only 11.4%. And the problem, poverty benefits always fail. This is a graph you may have seen before in some of our presentations, looking at the targeting errors to the right. The further you are to the right, the higher the exclusion area of poverty benefits. And if you look at if you go up the y-axis on the left, the higher up the program is, then the more the lower the errors. And you can see this black box here. We have a lot of poverty benefits with very high exclusion errors, some getting up to over 90%, whereas it's universal benefits that tend to be successful and reach their beneficiaries with almost 100% coverage, including all of those living in poverty. So how can we use this then? The fact that universal benefits are much more popular, how can we use this to build a universal social security system? Now, if we look at the kind of risks across the life cycle, and universal systems are built to address the risks that people face across the life cycle, which are the causes of poverty, you can see the basic benefits are child benefits, unemployment, sickness benefits, parental benefits, survivors, disability benefits, and old age pensions. Of those, when you look globally, the three core ones where they are the highest levels of investment are old age, disability, and child benefits. So we want to look at these three benefits initially as the core of the system upon which you can build other benefits, and see whether it's financially feasible to introduce these benefits on a universal basis over time. So what we did in the paper was to take the four benefits: old age pension, child disability benefit, adult disability benefit, and child benefit, and then try to introduce them gradually over time. So the old age pension would start a higher age of eligibility, 75 plus in 2023, and over 10 years fall to 65 plus. Child disability benefit that would start with the most severe children with disabilities, 0.5% of all age-eligible children, and expand to 1% by 2029. Adult disability benefit start with the most severe disabilities, 1% of all age-eligible adults, expand to 3% of the population by 2023. And child benefit would start with young children, those under 4 or 0 to 3s in 2026, and reach all children by not taking any child off, would reach all children in 2040, age 0 to 17. So we'd gradually grow a system to have a comprehensive system in place, perhaps by 2040. And the kind of transfer values that we put into our analysis were those that are pretty much the average transfer values, as you measure them by percentage of GDP per capita for the different benefits. You can see them here. You might think some of these values are quite small, but if you were to look at, say, India, where we proposed in $33.50 for a universal old age pension, currently India and its poverty benefit for older people only pays $2.45. So we're looking at a 15 times higher transfer than older people currently get in India. And in Vietnam, we're looking at around 3 times higher than people currently get in Vietnam. So in a national context, they're relatively generous. This shows the timeline for expansion of the programs. I don't have time to get into this, but if you wanted to see the presentation later or go to the paper, you can see how we gradually expand the system in different years so that we don't shock the system financially. And this, to give an example of India, is what we see. This is the growth in the cost of the system year on year. Paper was done starting in 2023. And you can see that initially it would be only 0.3% of GDP, focusing mainly on the old age benefit, relatively negligible amount of funding for a government to introduce. It would reach around 2% of GDP by 2040, still not a massive amount, and you've got 17 years to build that. And the annual increase is only around 0.1% of GDP, which could be easily paid for from economic growth and the extra tax generated from economic growth, even if there is no expansion of the tax system. So this is a relatively easy and financially, we think, sustainable way to build a system over time, allows for good planning, and it's necessary then for governments to put in place a long-term vision to build a system like this. Of course, once the population sees this kind of system, they'll probably expect government to do it much quicker, and that would probably happen, as in Montenegro, which put in place its child benefit a couple of years ago for 0 to 7-year-olds. It was very popular. It almost immediately, government expanded it to 0 to 17-year-olds. In the paper, we did three of the countries. We show the changes in costings here. As again, these are just very ideal levels. We can do a lot more work if we wanted to smooth out the increases here, but we think it's feasible. No country would end up with more than 2% of GDP by 2040. And if we look at the levels of spending of countries nowadays, low and middle income countries, on their tax finance benefits, you can see if you higher up the country, the richer it is. The higher the spending, the more you go to the right. And we can see if we're talking the maximum 2% of GDP, we already have some low-income countries, Nepal, Lesotho, and Timor-Leste, which are already spending around that or more than that. So this is perfectly fiscally feasible if the political will is there. Another thing is to show the coverage. If you put in place all those benefits by 2040, what would be the coverage? And here we're looking from the poorest household on the left to the richest household on the right, and the actual coverage here in each 1% of the population. And you can see that overall 82% of households would be reached by this social security system, meaning it'd be very popular, also be very shock responsive. If you have a shock in an area of the country, you could immediately just increase the transfer values overnight. So you don't have to worry about setting up a new system, expanding existing programs. You just have to increase the transfer value, as Mongolia did during COVID-19. They put in place a 4 times or 5 times higher transfer value on their child benefit as to be immediately responsive. And of course, the highest coverage is amongst the poorest households. And it's only households that have able-bodied adults, working age adults, that are there. And really, we should be focusing on helping them get into work rather than perhaps necessarily giving them benefits. Going back to the idea about before, I was saying we look at taxes, because we're going to pay for these any benefits that come in. If you look at this graph here, we're looking at the changes in consumption in India if you had the full system in place. What would be the change in household consumption? So the orange line shows there's no change. These are households that pay exactly the same amount in tax as they receive in benefits. And it's around 70% of the population. Therefore, that would be net winners. They would receive more in tax than they receive in benefits. This is looking at a tax system that is a little progressive, includes income tax, but it also includes VAT within the system. So it's mimicking to a degree what we find in many countries around the world. So these will be the net winners there. The biggest winners from this universal system would be those on the lowest incomes. We would see amongst the very poorest increase in consumption in India of about 80% per month, a massive change in the lives of the poorest people in India if this system was put in place. The net funders are the top 30%, but of course, as I said, the net funders, but they're also receiving the benefits, so they're going to get behind it because you never know, they may need it in the future. If they experience a shock, when they become old, they'll want to receive the old age pension. And just finally, then looking at the impacts on poverty, we took a sort of relative poverty rate in India and look what would be the impact. So found that overall the reduction in national poverty rate would be 70%, a massive reduction. And we look across age groups here, this would be the poverty rate without the universal system, would be the top of the blue line. And once the system is put in place, this would be the poverty rate with the universal system in place. So you can see big reductions across every age group in the population. So I know we didn't have much time. Sorry if I had to rush through that, but I'll just finish here, and hope it was interesting. And hopefully when you see Daisy's presentation, you'll see actually a lot of low and middle income countries have already started on this path. So I'll just stop now, and thanks for giving me the opportunity to share the paper with you.
Thank you so much, Stephen, and well done within the time limit, I would say. Just one question. You were already talking about something about how that there would be a combination of income tax or VAT and other taxation for paying for this. But I know that in the figure where you show the net losers and net winners, you assume that there is a progressive tax. If that is not in fact the case in a country, and they, which is I think quite common, rely to a large degree on VAT, how much would that graph actually change the picture, who would be net winners and losers?
Well, I don't think it would change that much. Actually, in the assumptions, it's a slightly progressive tax system because you do have VAT placed into the analysis, as well as some income tax. But I think that you can look at Sweden, your country, that's had a regressive tax system, but compensates for that with a whole series of universal benefits to reduce inequality. But I think the basic point is important. We shouldn't just think about benefits, right? If a system like that is put in place, then what we'll find is much more popular, and therefore governments will they'll get the broad support to put in place a more progressive tax system as well. And so that, income tax in many countries is far, far too low. There's not many people that are brought into the income tax system. That can increase. You can change how VAT is introduced and make the tax system more progressive, because you'll get the population behind you, allowing you to do that. Essentially, though, I think this system could be built on top of as I said, on top of the existing tax system, because it would only be 0.1% of GDP, which would come naturally out of economic growth, even relatively modest economic growth in countries. So yeah, I think there may be a slight shift, but not much in that. But I think we'd shift the politics in any country.
Okay, thank you. And for the record, if you look at the income tax, it's still slightly progressive in my country. But now we turn to next speaker, and Daisy Sieben. You are normally a social protection specialist at Development Pathways, but currently you're working for Partnerships for Social Protection, which is an Australian government initiative in Timor-Leste and the Pacific Islands. And you are now based in Fiji as a long-term advisor at the Ministry for Women, Children and Social Protection. And you have made the compilation study, so please tell us what you found.
Thanks so much, Gradual. Can you see my screen okay? Is that worked? Great, thank you. Yeah, really happy to be here today to present a very quick overview and some initial findings from a paper that my colleague Holly Segler and myself have written. And thanks to sp.org for organising this webinar as well. So again, we don't have much time, so I'll do a sort of quick overview to give you a flavour of the paper, and I think we'll be posting the full paper in the chat as well for anyone interested to read it. So just a quick sort of introduction to the general premise of the paper and a sort of the main objective of the paper as well. So it's often argued or assumed that universal lifecycle social security systems are really an option reserved for high-income countries, as sort of discussed just then as well by Stephen, assuming, of course, that that's because high-income countries are only the only ones that are sort of sufficiently wealthy to afford such great systems. And these are sort of systems that are designed to achieve the right to social security and the right to a decent standard of living for everyone. And indeed, the sort of multifaceted benefits of such universal systems, providing a minimum standard of living for all people within a society, to build resilience to risks and contingencies they might face right across the life cycle. This is very much widely recognised and documented. However, really, it's assumed that a universal approach to social security can really only be attained at this level of wealth. Instead, really, we wanted to look at the evidence and look to see what global experience can tell us, not just in theory, but in reality. So it's assumed that often on the policy menu, as it were, the only policy choice is really poverty targeted programs. And I think their discontents are very much widely documented, with high rates of exclusion and owing both to design errors and also implementation errors. But again, it's sort of this inevitability that that's really the only choice on the policy menu, unfortunately, in sort of a real world. Yet our findings from this paper really demonstrate positively that many low and middle income countries actually already are implementing social security schemes that offer universal coverage for life cycle groups, life cycle categories, and have made really good progress in building inclusive social security systems. The objective of this paper is really simple and straightforward. The paper simply seeks to document the universal life cycle programs. This is mainly old age, disability, and child benefits in terms of the tax-financed life cycle benefits that actually already exist in low and middle income countries globally, just simply to take stock of progress and highlight the positive stories of countries that are well on their way to, albeit gradually, building social protection floors. And in doing so, really begin to challenge the notion that maybe the only policy choice that is feasible for countries is poverty targeting, hopefully broadening out the sort of possibilities and ambition of countries and how they can use universal life cycle programs to progressively realise social protection floors. So just quickly, a definitional point: how does the paper define universal benefits? In the context of this paper, the term universal benefits refers to schemes that offer universal coverage of a clearly defined life cycle category. So, for example, for a universal pension, that would be all older persons above a certain age. And there are two main pathways through which low and middle income countries generally offer universal coverage on sort of a simplified level. This is either through a flat rate universal tax finance benefit provided to everyone within that life cycle category, or alternatively through a mix of tax finance and social insurance benefits within multi-tiered systems, which is also really positive in terms of the sustainability of financing over time as well. And this is depicted in the right image here, just looking at the bottom, we have the blue tier, which is the tax finance scheme, but it's benefit tested. And this is just to illustrate what that means is with benefit testing, only those who aren't receiving a benefit, an equivalent benefit, such as a pension from elsewhere in the system, for example, through the social insurance benefit, only those people would be eligible for the tax finance scheme. So overall, it would be universal coverage, but it would be benefit tested. And in this case, you can see it's tapered so that the benefit value is always set at a higher level under the social insurance system than in the tax financed universal system to reduce disincentives and promote better formalization. But moving on so quickly, that is just looking at the two types of benefits we've defined as universal coverage, universal and benefit tested. And just a very quick note on affluence testing. So in some countries, we know that governments have chosen to implement really impressively high coverage means tested life cycle schemes, which is often known as affluence testing. And while it is often much easier to sort of exclude the richest and seek to do that rather than to include only the poorest for multiple reasons, we don't have time to fully get into. And there are some really fantastic examples of very high coverage affluence tested programs, such as the social grants in South Africa. Technically, these still classify as means tested benefits. So for the purpose of this paper, for this compilation, we've not included them. It would get a bit too more subjective and tricky of what sort of high coverage enough. So we decided to just look at universal coverage benefits. So really what that means is that, the analysis presented here about the high number of universal programs is actually higher in reality because we've also excluded affluence testing programs, which are still really high coverage programs out there too. So where are these universal benefits found globally? Well, we put a little map together and you can see here the black countries are high income, just to mark them out to make it a bit clearer what we're looking at, which is the low and middle income countries. And globally, we identified 88 universal or benefit tested programs across 52 low and middle income countries. And that's 39% of low and middle income countries globally. So that's quite an impressive progress that's already been made towards the realization of universal social protection floors. The Pacific is leading the way with the highest proportion of low and middle income countries implementing universal coverage schemes at 77%, followed by Europe at 64%, 53%, so over half of all countries in Asia, 25% in Latin America and the Caribbean, and 20% of African countries implementing universal coverage, at least one universal coverage program. So we'll look now very quickly at the sort of types of benefits found across countries. As I previously mentioned, we're looking at the sort of core life cycle benefits of old age, disability, and child benefits. Of course, there are additional social protection benefits that make up the sort of rich tapestry of social protection across the life cycle that are also really important. But we're looking here at the main three categories of tax finance universal life cycle programs. For example, we know unemployment benefits are also a critical part of these floors for working age people. But generally, these tend to be not only tax financed, although I think in Kiribati, I think Shirin will hopefully talk about the unemployment benefit that has actually been introduced there as well. So for now, we'll just talk about the old age, disability, and child benefits because these are the ones that are coming up. So firstly, the most common universal benefit that we found when we were looking was old age pensions, which generally are the first scheme many countries choose to establish when incrementally building a life cycle system. So globally, we found 46 low and middle income countries that were currently providing universal coverage old age benefits. And many of these began implementing these with relatively low levels of wealth. Stephen's gone into a bit more detail about the sort of the assumption about the correlation between wealth and investment and how that's not always so true. And here I just wanted to present a similar argument or some similar evidence just to show this graph, which is showing the GDP per capita in purchasing power parity terms of low and middle income countries that do have tax financed old age pensions in the year that they were introduced. So we're using GDP per capita as a kind of crude proxy for the wealth of the country, and we're mapping what that was in the year that their pension was introduced. So we can see on the x-axis we have the year, and on the y-axis we have the wealth in that year. And it's color coded, so the orange countries are universal, and the blue ones have got benefit tested pensions as well. So yeah, just to show here, we can see that quite a few of these countries at relatively low levels of wealth at the point where they've introduced or at least begun to progressively roll out and introduce their social pensions. We've also included some other low and middle income countries and the wealth of those countries in GDP per capita terms in 2023, such as Pakistan, Algeria, and Indonesia, just to act as some kind of crude yardstick, just to show, these countries are either as wealthy or more wealthy, but they haven't gone down that route of investing in universal programs, just to make the point that, it's not necessarily correlated to wealth. The decision to invest in a universal program, just illustrating simply that it's a choice that countries can and are making. So, for example, Mauritius, when Mauritius introduced its pension in 1958, it was a much poorer country than it was today. And we know so much sort of literature out there looking at how popular the pension is in Mauritius and how it's had a lot of political backing and sort of expanded over time as well. And I think it's been a really core part of Mauritius's economic growth trajectory too. So it invested when its economy was in a much smaller scale. And also Kenya introducing its pension universal pension in 2018, again at a relatively low level of wealth as well. I haven't got much time, but in the paper we talk quickly about some of the impacts of universal pensions and other benefits, and really sort of contextualizing what it means for countries to be choosing to invest in these benefits. And We can see very quickly here, this is showing pension benefit values in Bolivia and Georgia, which both have universal pensions, and looking at the percentage of household per capita, either consumption or income, that they represent among all households of pensioners across the welfare distribution. See the poorest households on the left or the richest on the right. We can see on average that overall there's a very sizable boost to consumption and income that they represent, equivalent to 48% and 23% respectively. But also they are, a very pro-poor policy too. Obviously they're universal and they're including, importantly, all older people. But we can see relative to wealth, they also represent sort of nearly 100% increase for the poorest households, which is really, really meaningful. It's their sort of only source of income. But beyond using consumption as a crude indicator of welfare, international evidence has also demonstrated how older persons with no income of their own can really experience social exclusion, discrimination, and isolation. We know when people access pensions, they can be empowered and maintain their autonomy, enjoy greater inclusion with communities, and also use pensions to support grandchildren and engage in small enterprises. So just to sort of contextualize the value of these pensions is sort of broader impacts on well-being in old age too. We wanted to include some information on a level of investment in the paper. So we can see very quickly, I'll just skim past this, but level of investments in old age pensions, where the data is available, really does vary from this investment of 7.02% of GDP in Mauritius. As I said, a really strong pension system that has quite a lot of political backing and has grown over the years, down to Uganda, which invests 0.04% of GDP. But that's in recognition that it's really expanding that over time, and it's at the moment it's just provided to older persons aged 80 plus, which is quite a small population in Uganda, and the aim is to sort of reduce that over time. So again, there's sort of different stories, different contexts, and different trajectories for these countries, and many choose to roll it out progressively by lowering the age eligibility. But we can see here that it does range, but a lot of countries are investing a sizable amount in their pensions too. Very quickly, disability benefits. Globally, 30 low and middle income countries currently provide universal coverage disability benefits. And again, some began implementing these with relatively low levels of wealth as well. One example to highlight here is Kiribati, which implemented its universal disability benefit in 2018 with a GDP per capita of just in PPP terms of under $2,000. So again, just illustrating that there are countries with lower levels of wealth that have really made this sort of, with the political will, made this decision to invest in rolling out these universal benefits too. Again, there's limited information actually on the level of disability and of investment in disability benefits, unfortunately, but where it's been available, we found that the annual level of investments in disability benefits varies even more so. There's two sort of main reasons for this. It in part can really be explained by some benefits only being provided to those with the most severe disabilities, and the eligibility being quite strict in terms of the disability severity, and also other benefits using disability assessments with sort of significant barriers to access. But also it's sort of in recognition that there's a lot of diversity in disability benefits and their objectives. Some are about addressing additional costs and sort of more about providing a personal independence payment, whereas others might be income replacement or funding full-time care, for example. But generally, with the proportion of the population of disabilities tending to be relatively small, this does make funding disability benefits more affordable to introduce generally, notwithstanding the need to implement and develop a strong disability assessment system too. I'll skip over this as well because we don't have much time, but just to show that the strong impacts that disability benefits can and do have. And finally, child benefits. So universal child benefits, these are the least common benefits out of the three benefits that we found. But we know that they're becoming increasingly a popular policy choice, more and more in recent years, as the wide-ranging positive impacts of investing in children become really increasingly acknowledged, which is really positive. We found globally that 11 low and middle income countries are implementing universal child benefits. But again, the age eligibility varies. Again, this is sort of part, I think, of this progressive realization strategy of having this principle of universality, so not means testing, but restricting the life cycle category and using that as a basis to expand over time. And as Stephen says in his presentation, sort of tapping into the distinct political economy advantages of having inclusive systems that tend to be quite popular. So we've seen only 4 of these countries actually providing coverage to children 0 to 17. These 4 countries are Argentina, Libya, Mongolia, and Montenegro. And we can see from this graph as well, the same as the 2 graphs before, that several countries were relatively poor when they introduced their schemes. For example, Mongolia made its child money program universal for all children in 2012, when its GDP was just $6,800 US. And we can see again, we've just put some crude benchmarks there of different countries that are either just as wealthy or wealthier, and haven't gone down the route of introducing universal child benefits, just to sort of contextualize that these programs have done that at relatively similar levels of wealth. And again,
very soon.
Sorry, thank you, Gunnar. Sorry, I've gone over, haven't I? Yeah, this is a point that was previously made as well, but just looking at the significant impacts really that UCBs can have on the well-being of children, but also as well on providing the basis for a highly effective shock response. This was a point I was going to make about Mongolia's child money program, but I think Stephen had already discussed that. But essentially, being able to reach a very high proportion of their of households in a country from a systems perspective is really valuable in being able to effectively scale up support emergency response during a crisis. And we saw that Mongolia did that very effectively. And actually, they've maintained that benefit level. I've heard from recent correspondence, the last I've heard is that Mongolia has decided to keep that increased level of payment. So that's really great. And again, level of investment very much ranges. But we can see Mongolia comes out top as investing the most in its program, and Nepal investing 0.07% of GDP roughly in its universal its child grant program. That's also testament to this progressive realization strategy with rolling out sort of geographically as well. But hopefully, if Dr. Loknath can join us, he can tell us a bit more about that too. Finally, just to conclude, in the paper, we found that universal programs are not only feasible in theory, but that they do exist. And really importantly, that they tend to be primarily government financed, which is really great to see too. We saw 52 middle-income countries introduce a total of 88 schemes. 47 were pensions, 37 disability benefits, 11 were UCBs, and 1 universal basic income in Iran. The existence of so many universal schemes challenges the assumption that countries cannot afford to build inclusive social security systems using the principle of universality. It's not necessarily saying that every country can, it's just saying that we should not count this out as an option, and that we should perhaps broaden out this policy menu that's being considered. In contrast, these experiences demonstrate that low and middle income countries can begin their journey towards life cycle systems by taking a gradual approach, whatever that means for each different context, to expanding their systems over time through the principle of universality. And by doing so, low and middle income countries will likely realize the right to social security for all over time. We hope that the data presented in this report will serve as a useful sort of starting point and foundation for further generative discussions and more empirical research that can sort of deep dive into these universal programs that exist today. Questions such as how have these countries managed to finance them? What were the sort of conditions for them emerging, and the politics around these kind of questions? There's definitely more to delve into, but hopefully this simple compilation paper can be a starting point for that. Thank you.
Thank you so much, Daisy. And just to add, I think we're all aware that there's been so many impact studies and evaluations of the donor-funded programs that are poverty targeted. I wonder whether there is also a lot of research going into the impact of these universal nationally founded. But Daisy, you have been writing this report with a colleague, so I assume that you got this task because you know something about it before. But in the course of making this report, is there anything that really made you surprised, or did you find more or less what you expected?
Thanks, Gradual. Yeah, I mean, there was, I think I was surprised by the sheer scale of countries that have introduced universal programs. You know, there's some great stories that we've been familiar with working in the field for a long time, Mongolia and Nepal. But generally, you know, looking at this, in all different regions, yeah, it was really encouraging to just highlight these programs that not necessarily would, like you said, have the same impact evaluations or attention. So it's nice to sort of have that kind of global overview. And I think also just the highlighting the Pacific region as being a real leader in terms of these universal programs. Again, something which I don't think attention on, looking at, you know, for example, Fiji, where I'm working now, a really fantastic universal pension and disability benefit. And that's these building blocks within, you know, a broader social protection system with other things going on. But yeah, I think it's great to have the Pacific having a bit of a limelight and celebrating the progress here too.
Thank you so much, and really starting to make the link to our next speaker. So Shirin Gul, you started as a researcher on gender issues, and you're now an expert on social policy and governance. And at present, you are director at the Social Protection Unit at a ministry with a very long name at the government of Kiribati. And as I've understood, you're also part of this Australian initiative Partnership for Social Protection, which Daisy is presently working at or with. So please, what your thoughts when you have heard these presentation, and what can you share about the situation in Kiribati?
Thank you so much, Kunal. And thank you, Stephen and Daisy, for the presentations as well. Well, for very clear reasons of being where I am, which is Kiribati, honestly, my interest was more in the report that Daisy did, because obviously we already have universal programs, but sometimes it's as if we are doing this as a unique case, whereas what Daisy's report obviously brings out is that there is enough programs around the world which tell us that, you know, the choice of building social protection floors in that manner, and indeed to actually have that demonstration of state-society relationship is a choice that different countries need to make and can make and should make as a national priority, rather than you know, looking at whatever's available, because whatever's available sometimes, like Daisy said, can be tilted towards one kind of programming only. So that, I think, was more, for me, that was more appealing to sort of see, because the case here was not, there's no reason to make a case in a country where there's already universal social protection program. But I think a lot of it did resonate with me in terms of, yes, it was gradual here as well. Yes, political will has a lot to do with it. And yes, it is not, you know, the financing as well is from the governments and not necessarily from development partners to begin with. In fact, it was for the first time in 2021 that the government of this country reached out to partners for some technical assistance also on social protection, but that was very clearly on the delivery reform and sort of system strengthening, because they had done some really progressive reforms in 2020 in terms of also expanding the program. So, and within that, you're absolutely right, you know, that this is under the Australian regional program, which goes by the name of P4SP, or Partnership for Social Protection. But I do have an inline role as well, which is within the government, and sort of looking at Kiribati and its sort of journey that it had of the universal program. So Kiribati is, as most of us would probably know, but just to sort of, get that perspective a little bit more. So it's a country which is spread across 3.5 million square kilometers. That's actually larger than India, the country of India, right? Because we were talking about India as an example. But it's all water, it's ocean. Because the total land area, which is spread over 33 atolls, is 811 square kilometers. And then you have a population in those 33 atolls of 119,000. So it's a little different, but it's so when you look at it, when you look at a country that's really huge, but with a small population, you realize that how the economy would work, how everything else would work, and the GDP per capita, I think, is along the same. I think Daisy also mentioned it when she was talking about the disability one, but even the Uganda or Denmark, which are mentioned in the report, so at around 3,000 USD right now, 2,960 USD per capita GDP, it's kind of comparable to where countries were when they started this. And Kiribati actually introduced the universal social protection program there, which was called at that point the elderly benefit in 2004. It was a very modest scheme with a cutoff at 70 years of age. So anybody 70 and above was eligible, and a modest amount as well of 30 Australian dollars per month. And for a long time, there was consolidation, and just because it's a spread, just getting enough people on the program. And then around 2016, by 2016, the benefit had increased to $50 a month, and the age had been brought down to 65 years. However, it was only in 2020 that the elderly fund, as it used to be called, it actually was transformed into a more overtly rights-oriented program when the legislation on the senior citizen allowance was enacted. And this was a clear demonstration of not just political will, but also political consensus, because it showed that social protection is a bipartisan issue in Kiribati, has been, continues to be. When the Senior Citizen Allowance Act was unanimously passed by the Parliament. And when we say 2020, it's often sort of, people often go back to COVID and think that this was like a COVID response. All of this happening in Kiribati was COVID response. Actually, it wasn't. These were things that the incoming government had in their manifesto. And if we think about it, actually, this side of the globe really felt the lockdowns and the effects of COVID around 2021. So 2022 policy was not influenced by COVID. This is just so, because when we think 2020, we immediately think COVID. So it's just to sort of, if any perception of that sort is there, just to, and I think, so I think the important thing is that when I say that they were that it really became right, obviously by legislating, it was an entitlement, it was recognized as an entitlement, but also it increased the coverage as well as the benefit amount. So whereas it was a $50 per month benefit, the legislation, the entitlement is now $200 Australian dollars per month. So that's quite a jump. And along with that, the coverage has also been increased because the cutoff is now 60 years of age. So anyone who's 60 years and above is now eligible. And what you were talking about, that there may not be, the kind of studies that you have for donor programming, but clearly there was enough evidence, there was enough knowledge, there was enough experience of the decision makers in the 16 years or so for them to unanimously pass this legislation. And since then, since the act has come in, we've done some micro simulations, and we do see that actually in terms of consumption, SCA accounts for 60%, up to 60% in the bottom decile, and then it gradually obviously decreases the consumption effect, and it is around 30% in the top decile. So it's again quite an impactful benefit and program. Similarly, in terms of and again, this whole thing of when we look at any of the programs which are any of the policy, any of the benefit design, when you read the documentation around that in Kiribati, nowhere would you see the word poverty mentioned. But in each and every one of them, you will see standard of living. That again takes you back to or at least takes me back to the wording that one finds in the Universal Declaration, of course, of Human Rights. And again, the impetus is around there rather than, and in fact, we have looked at the poverty impact in terms of the microsimulation, but here we talk in terms of the government, the policy, the government policy, the parliamentarians. Everybody talks in terms of standard of living. Then interestingly, actually, yes, as Daisy said, there is a universal disability program as well, which was indeed introduced in 2018. And initially, the benefit range was 30 to 50 Australian dollars, depending on severity of disability, which obviously means there was a disability assessment. Then in 2019-20, that was changed to a range of $50 to $80. Again, a lot of what was said in the report, Daisy, is what we are also facing, and actually we are right now. And this was really interesting because initially, when we came in with the TA in the government, we weren't looking at the disability support allowance, but then the disability, the head of the disability sort of came and had this conversation where they were feeling that the disability assessment has some accessibility issues. So we are now looking into a review for the program, and where we are looking at different options, including assessment methodologies and alternate mechanisms, and perhaps even interlocutors for identification of beneficiaries. But again, the drive from that came from the disability, because as such, we were looking at two different programs, which is where I have not gone into the detail of the unemployment benefit, because as such, it's not within the definition that we have for universal programs in the papers. But I do want to draw on one thing, which is to do with, like, which is based on, perhaps most people here would be able to relate with this experience, that when we think of good social protection design, there are different principles that I emphasize. Sometimes it's fairness and efficiency and equity. Sometimes it's fairness and equity, sometimes and transparency. Sometimes it's equity and efficiency. But oftentimes, what is overlooked is administrability. And I think a good design has to be fair, equitable, and administrable. And perhaps, learning from experience in places like Kiribati and perhaps even other Pacific countries, we have to consider that, especially in small systems, even the gains in efficiency are largely dependent on the principle of administrability. And quite often, when we're talking about any kind of targeted programs, administrability in small systems is really a stretch. And so we have to consider that, it's quite clear, even in Kiribati, it's not a poverty targeted program, it's an unemployment, but by virtue of being an unemployment program, there are certain other criteria for eligibility and eligibility that have to be considered. And it is very clear that a universal social protection design is most efficient because they're administrable, because they rely on data and systems which are already available even within small systems. And mostly, as we know, that's civil registration-based data, and there's no extra data collection or analytical read. And administration has a cost, creating new data has a cost, and countries that are just starting out, especially small developing countries, I mean, they should not be expected to stretch their human resource, their financial resource, not only to undertake, but also to maintain the extra data and analysis. These are things that we don't talk about, but I think, I mean, you know, they're not, obviously we talk about them, but they're not probably as fungible or as tangible as some of the other things that are brought into the case. But really, the worst thing about not following the principle of administrability is that seeming to fail has its own cost on how social protection would then be looked at, and how the narrative around social protection in a particular country would be made. So really, that, yeah. So just on the last part of this would be, sorry, if I'm out of time, I can stop here, but it's just on the policy perspective, where I think not only is Kiribati implementing universal social protection program, they're also looking at them as their investment in resilience. So they are also looking at those as their shock responsive programs. And that was very clearly stated, not only in their vision, which is called the Kiribati Vision 2030, the 30-year vision, but also in the COP, the plenary speech by the president, very clearly talked about the investment in social protection as the investment in resilience. And I think that's very important, because when we see that there are so many different types and typologies of social protection that come up, that we almost miss the whole. So the parts of the whole are always bigger than the whole, and we miss that point. So I think that also is something that we need to bring back into the discussion. But I'll stop here for any questions and any comments after this. Thank you so much.
Yeah, and thank you so much, Sheena. I think you had it was fascinating also to get this very concrete illustration of many of the messages of the other reports. And I really take with me also what you said, that it's standard of living rather than poverty, which is the main concern in the political debate. And I think that's something we really should think about more in many different contexts. Just one question. You and it was coming out from Daisy's paper also, that very few, if any, of these universal programs are supported, where the transfers themselves are supported financially by development partners, but you yourself are then working as part of a technical assistance. And in the debate, I mean, some of us are complaining when World Bank and others tell countries to go for more targeting. On the other hand, you could say, who are we to tell countries to go for universality? So how do you see the role of development, cooperation, and influence on, and what kind of role can you or we or the development community play in supporting the developing in countries? And what are the dilemmas that you see, if any?
No, thank you so much. I think that, thank you for asking that, because I think that's where my interest in this report came from, because it's almost like a crowding out of any other within. If you only look at what the development sector by and large, or development partners are by and large producing, then there's almost a crowding out of any other but a targeted and a poverty targeted kind of policy or design for social benefits. I think that's a bit. So if you are in a country where universal social protection programs are working, it's good to sort of realize what else to look at, what else to learn from, and how else to analyze your own programs. As for the experience itself in Kiribati, so I have to say that this is an Australian government TA, and as such, my experience so far has been that the design principles, or the policy principles, or parameters, I should say the design parameters more than anything else, are coming very much from the government, and they're not being challenged by the donor that is providing the technical assistance. But in terms of system strengthening, in terms of that journey of how you improve delivery systems, that kind of experience we're bringing in, and hopefully as a value added for the government itself. But in an overall sense, that because the social protection space is a contested space also in Kiribati. So for instance, when you talk amongst donor groups who are looking after some of the budgetary support or some of the other programming, there will often be this argument of efficiency, which almost sort of, in the argument becomes an argument for targeting. It's almost like another word for targeting. So there's almost an assumption that not more than a certain percentage, if more than a certain percentage of people are getting social protection, there must be some inefficiencies. So I think those kinds of dialogues are difficult to sort of, obviously all dialogue is good, but these are difficult when you don't have enough evidence from other countries as well. So that's where I see something like what Daisy and Holly have done to help, because what happens then is, Gunal, that it's easy to sort of say, okay, Pacific is unique. Kiribati is unique. Now, you don't want to be unique in a manner where the uniqueness is meant to say, okay, till such time that this doesn't happen in this country, it's okay for you to go. No, if the country wants to take it for the next 100 years, they would take it for the next 100. So I think that kind of boxing in, if we see it across the globe, the way this report sort of brings it out, that kind of boxing in, we will not have then. And yes, the Pacific is unique, and yes, the Kiribati experience is unique, but not boxed in. Thank you.
And thank you so much. And add to what you said about efficiency being almost another word for targeting. I think the word leakage is often used when money is going to non-poor, and that word, of course, could be, it has a value into it. So I'm afraid that, and please, our colleagues at socialprotection.org, can you confirm that Dr. Busal is not with us, or is he here? I don't see him. So unfortunately, we had very much looked forward to hear from the Nepal experience, but that will have to be for another time. So now we will open up for questions, and I find a lot of questions in the question box. So we go straight ahead, and the first one is from Reinhard Haas, and I think it's for Stephen. Why is the effect on poverty strong in the old age group than in the children age group, according to the example of India?
So yeah, no, it's quite simple in a way, in that the older people were providing income replacements, an old age pension, because people can no longer work or have much more reduced capacity work, so they get higher value transfers than the transfers that are provided to children. So you would naturally see greater impacts. But the way the analysis works, every benefit that is done is divided equally in the analysis between every member of the household. So in fact, lots of the impacts on children come from the old age pension as well. We know that many countries, old age pensioners spend the majority of their money on their grandchildren. So their old age pensions paradoxically are a great benefit for children. They reduce stunting. If you live with an old age pension in South Africa, a study shows you between 3 and 5 centimeters taller than if you didn't live with a pensioner. So, but it's really about the level of transfers that we.
Can I just sneak in a similar question then? I noticed in the paper that the impact on child poverty was the largest in India of the 4 countries you studied. Why is that, do you think?
That'll probably be down to family size. I think larger families, more children, etc. So we'd have to look in the exact sort of demographic. What we did was just apply the same rules to every country, and that's how it came out. But I would think it would be the demographics that you find of household size.
Okay, and actually I forgot to invite Daisy and Stephen if you have any comments to Sharing Goals input, if there's anything you would like to add based on that. You can think about that and
I mean, I could say I was at Kiribati 11 years ago, and they already had an old age pension there, but I think it was for everybody over 70. I argued strongly when I was there for a universal disability benefit that's been introduced. The age of eligibility has been reduced by about 10 years in Kiribati. It's making a massive difference to the lives of people in Kiribati. The whole sort of universal system that has been put in place there.
Yeah. Now, Daisy, here's a question from the audience from Clarence Toos from South Africa. In your research, you've explored the possibility of linking these universal social protection benefits with employment-based programs to ensure the sustainability of these programs, especially in low-income countries.
Yeah, thanks, Clarence, for the question. Yeah, I think really this is a question, sort of a thought that comes up in many countries in terms of this idea of graduating out of benefits or the need of benefits. But I think really it comes down to looking at what the objectives of different programs are and how those sort of are designed appropriately for meeting those specific objectives. And when we look at lifecycle social protection programs and we see child benefits, disability benefits, and pensions, generally they have their own natural, I guess, graduation strategies. Generally for child benefits, that would mean, aging out of that need of no longer being a child. And again, that's owes to the universality of it, that we all either are children at some point or will have children. So therefore making it inclusive in that sense, but you sort of grow out of it. Or disability benefits, the sort of objective of that is generally to support a standard of living of someone who's living with a permanent disability. Generally, there isn't a graduation out of that. It would tend to be something that people would require throughout their entire lives. And the same with pensions as well, in terms of really the ultimate sort of graduation out of a pension is you have that until you die. So these are sort of, it's difficult to conceptualize graduation when these benefits are sort of a lot broader and more holistic in their objectives than just poverty reduction. And I think that's a bit of a shift away from just poverty focused programs, in which this idea that you can graduate out of poverty, and perhaps for some programs that could work and you could find a way into employment for those of working age, which is obviously the ideal situation for an individual and for an economy. But I think looking at life cycle benefits, we really need to think more carefully about what those objectives are. And these are often people that might struggle to graduate into employment as well. So it's about looking at the different sort of target groups. But I think that also leads really nicely to the questions from Shay and Farah, looking about sort of thinking about linkages between social security benefits and sort of employment agenda as well. And I think when you begin to bring this idea of multi-tiered systems into the picture and into view as well, then it becomes really interesting. And I think this is something which can be sort of further explored as well when looking at benefit testing. So I only mentioned it briefly in the presentation, is just looking at sort of from a definitional perspective of the types of benefits that we included as universal coverage. But Shay's asked a little bit more about the differences between that it's important to distinguish the difference between poverty targeting and benefit testing, which sometimes is not always appreciated in social protection debates. Which I'd agree, these are very, very different sort of design choices, and also about saying a bit more about the pros and cons of benefit testing in terms of design, cost, and delivery of these programs. And I guess just the way of bridging these two questions, looking at how actually the design of benefit tested programs can support the formalization agenda. There's the purpose of using multi-tiered systems, so that's using universal tier along with a social insurance tier, and making sure those two really speak to each other and are carefully designed within that national context. The purpose of that being, to really support more inclusive coverage of that system. For example, if it's a multi-tiered pension, more inclusive universal pension coverage among the elderly, but also in terms of the link, making that sort of more financially sustainable over time. So over time, reducing less and less, relying less and less on the tax finance tier, which is inevitably really important in terms of making up that coverage gap, especially in economies, in societies where there's sort of a high level of informal employment. But looking at actually over time how to grow that social insurance tier, which would obviously be funded through the principle of solidarity financing and through social contributions, which actually sort of investing in that vitality of that social insurance financing will really reduce dependence on tax financing over time as well. So there's a really strong, I think that's a really attractive option for countries to look at how to grow multi-tiered systems and to actually also use that tax finance tier to build up that social insurance tier as well. So looking at how, that point of contact that many people would have in claiming and registering for a tax financed program, actually that sort of having linkages to greater awareness and sensitivity towards the social insurance system and more kind of understanding of the benefits of actually formalizing employment as well. So looking at how programs can be designed to offer an increased level of benefit in the social insurance tier, and working to build that multi-tiered system and actually not just create better, more sustainably financed programs over time and universal coverage, but even in pushing forward that formalization agenda too. And from a delivery perspective, benefit testing is much more administratively straightforward or objective way to reach universal or to reach coverage of a program compared to poverty targeting as well. But yeah, I'll stop there. Thank you.
Thanks, Daisy. I think we've lost Gunal. I think her connection might be off. So I'll just take over with the questions. Stephen, I think this next question can be to you from Valentina. What about countries where there is not a system in place to diagnose and rank disability and elderly do not have a birth certificate? Have you done any work on the estimation of costs to put systems in place to actually be able to start universal programs?
Yeah, so I think for old age, there's countries, we did a lot of work in a country like Uganda, right, middle of Africa, very challenged. Not a lot of people have, birth certificates who are old now, but there's ways in which you can determine age by putting calendars of events in place to determine age and get people into the system. So this has been done in a number of countries. So it's not particularly problematic. And compared to the total cost of the scheme, it's a tiny proportion. The administration of universal benefits is probably less than 1-2% of the total cost of the transfers, much higher in poverty benefits. On disability benefits, setting up the system, robust system of disability assessment compared to the overall cost of the benefits is not very large, right? It's probably, you could pay it through, just delaying the implementation of your scheme by a couple of weeks. The savings you'd make would by far more than cover setting up of the disability assessment system. But of course, you have to be able to pay people who do that assessment system. So disability benefits are more expensive in terms of administratively because they require a more robust assessment system. But they're well worth all countries investing in, because once you have it in place, it'll still be relatively low cost for people to go through compared to the benefits, but then it can be used for accessing many other benefits, subsidies for free transport, health subsidies, getting free health, etc. A whole range of other things can be used if you have a good, robust disability assessment mechanism. The challenge is put in place, but there's lots of potentially good examples that show you can do it.
Great, thank you. Gunal, are you here?
Finally, yeah, I was completely, but please take up the next question and I will try to find where we are.
Okay, sure. I can take this next question to Shireen, perhaps. Matthew Greenslade has asked a question about evidence of donors following government's lead and shifting towards supporting universal or benefit tested schemes. So do you have any comments on that? Or if others also can chime in.
Thanks. I think it's a dialogue, and it is as much the government also sort of making its case clear. And I think where the government has invested its own resources in the benefit, obviously the negotiation space is more. And I do believe that Kiribati, if we look at it from the perspective of how first and foremost, the technical assistance itself is also budgetary support. So there's more of a control of the government over how they want to spend that money as well. Of course, the accountability is to the donor as well. But it's respectful of there's a clarity in terms of the support is to make sure. Of course, there are always what one may call a small, like, a small p policy issue, which would still come, because that will be something which will directly be directly be hampering or facilitating how something is delivered. But other than that, I think there is that healthy respect of keeping those roles very separate, whereby the agenda is something that the government is setting on this. Having said that, not all donors are the same. There will time and again be donors which will bring other things up, and I think those of us and everyone around this table who works on this sees that sometimes the problem that comes in is that, yes, there is delivery reform, but then sometimes technology solutions are posed as if they are policy solutions, and vice versa. And I think these kinds of, when these things happen, there is a more of a jumble up, because a government may be taking a technology solution on as a technology solution without realizing that there are policy implications. And I think that's where those are the more trickier parts of how technical assistance should work, because by virtue of being simultaneously being part of a development partner or donor supported technical assistance and the government, there is always that call that one has to make, because you can see things like that coming up. You're breaking up a social protection system so much simply because you want a specific kind of flavor of social protection at that point. But these are not things that immediately every national government would know. But I think these are two things that happen. And third is obviously making something sound so technical that it almost becomes esoteric for others to, for government bureaucracy, because bureaucrats are not necessarily specialists. They work across different ministries and they have their strengths, but they may not be specialists and all. So I think these are some of the things which become trickier. But otherwise, if we have a clarity of roles in terms of the agenda setting coming from the government and the other strengthening coming as technical assistance, things in Kiribati are running smooth, except that every now and then we have a little bit of these things coming in as well, where we have to almost peel the layers and sort of talk through these things a little bit more, both with the donor and the government. So I think we have to be a little wary of these things, because sometimes they can be disguised as reform or disguised as implementation, but they're actually policy. They're really clear and big policy implications that we are taking on if we take that advice on as governments.
Thank you so much. And I should say to Chani, thank you for stepping in. And since I've now come back into the meeting, I cannot see all the questions that were, it's empty for me. So I leave it for you to pick up the next questions.
Right. Thank you. And I think we only have about 4 minutes left. So I think I'll give the floor perhaps to Daisy, if you want to comment on anything that Shireen might have just said, or if there's anything in the questions that you'd like to pick up on, and yeah, we can give you the last word there.
Thanks, Chani, and thanks everyone. And Shireen, I think that was really eloquently put, and yeah, really interesting to hear your reflections on that that dialogue. I don't have any final words prepared, but I guess just the final reflection of hopefully what the paper is just opening up the space to have these kinds of conversations, that there's not necessarily a definitive answer of this is, as Gunnar said, that, you know, pushing this ahead of this, or you know, being too overly prescriptive of a certain you know, approach, but more, I think, just evening out, you know, this current situation of an overemphasis on poverty targeting, which is, you know, a very natural reaction, I think, to, you know, the fiscal constraint that every country has, but just trying to think a bit more critically about actually, you know, theoretically, how this pathway could be forged towards more universal coverage, and more kind of rights-based systems that can more adequately, you know, meet the need that's there, but also just looking in reality, and actually taking stock that really countries already are. And I think Shirin really has exemplified that really well. Just it's giving us a bit of a flavour of the case of Kiribati and the politics there. That I think interesting in that case is sort of how, you know, the ideas and the politics and the will to implement these programs and the sort of belief in this design of being inclusive has you know, happened more quickly than the systems were able to catch up, which I think is interesting. But I suppose, you know, that's just a matter of, again, you know, financing, and that's, I guess, where development partners can also be very, very helpful and valuable partners for national governments as well, to helping them kind of realize their vision on that sort of more systems level as well. And that's sort of, yeah, we'll have to keep a running database of these programs that we have. Obviously, the paper documents only as of 2023, so everything's changing all the time. And again, you know, all errors that we accept as our own, as mine and Holly's own. So any other programs that we've missed out, please let us know, and we'll add them in, and hopefully we can share them on the website online, so we can have an evolving living database and see where we go from here. Thanks, everyone.
And maybe I then step in and let problem with the techniques today. Stephen, you have say half a minute final word, and then because I will also first say that please put on the poll again to see if the ideas of participants today has changed. I think we are not as many participants now as in the beginning, but at least we can see if there is. So please just click and we will see what comes out.
Well, yeah, I can say in half a minute. I'm just working in a country now in the Middle East, you know, where we've been working, and the government, we provided training and seminars on universal social security. The reaction was, hey, this is the first time we've ever heard about this. No donors have ever told us that this is possible. And now they're very enthusiastic to see whether it's possible and financially feasible to introduce the schemes, and we're now working with the government to assess that. Of course it is, if there's the political will. But I think it is noticeable that, you know, this is not a message that is coming across from many donors. There are exceptions, but it's not generally the message that comes across, and we need to change that.
Thank you so much. And I think we will then come back to, yes, we got those people who weren't sure are now more sure. So I think that's a good sign from the discussion today. And let's hope that this is really the beginning of a discussion where it usually stops. So we look forward to more discussions and more studies on what actually happens. And I would just like to say to everyone, because I've seen a few questions, that can we see the presentations? Yes, you will get them, I think, by email if you participated. And it's also possible to follow this webinar again if you look at the website and the site for this webinar at socialprotection.org. So thank you, socialprotection.org, for very good cooperation. Thank you, Development Pathways, and everybody who joined today. Thank you very much. Have a good day and night.
you.
Thanks. Bye.
Bye-bye.
Thank you. Bye-bye.